Welcome to week 4. This is our second lecture. We are going to be doing patient-centered care, this is a very, very important topic because this is going to be, the heart and soul of what you do as a nurse, all the care that you provide to your patients. So, what is all included in thoughtful, person-centered practice? So, the first thing that comes to mind is the person. So the person, there's things you have to remember. So each person is unique. Each patient or person has their own set of beliefs, their own set of values. They hold their own memories. They have their own hopes, and they have a unique history that is unique to just them. Patients are people, and they're holistic beings. They have emotional, physical, social, and spiritual dimensions. And they have needs that all meld together to create the whole individual person, okay? It's not just the physical aspect. So you have to recognize that each patient's health journey is their own, and each person's care is going to be individualized. So clinical care is what we can call an interaction between the carer and the cared for. So the nurse is the one who provides the care, she's the carer, and the cared for is going to be the patient. That's the people that the patient is who we're going to provide care for. Each of the people in this relationship are unique. I'm unique, the patient's unique, you're unique, the patients that you care for are going to be unique, and the respect and valuing each person and their individuality is going to apply to both you and your patients. And then you have the professional nurse. Professional nursing does require educated personal attributes along with a mastery of the science of nursing through your education, and then some reflective clinical experience in which you as the nurse develop a blend of competencies and CUSIN competencies, we talked about that a while ago, that allow you to promote thoughtful and effective person-centered practice care for all of your patients. We have reflective practice leading to personal learning. So reflective practice happens when the nurse has an awareness of herself. You have an awareness of your own biases. You have an awareness of your prejudgments, your prejudices, and any of your assumptions. And then you also understand how these affect the care that you deliver to your patients, and how those thoughts can hinder the development of a trusting or a therapeutic relationship with your patients. The awareness is developed through a process of reflection. So you think back on what has occurred for the purpose of learning and what you need to do to change it or improve it. Then you have clinical reasoning, judgment, and decision making. So clinical reasoning is the process for analyzing a situation, looking at everything that's involved, being able to make a judgment, deciding on what possible alternative treatments or reasonings you have, and then you have to choose which action that you're going to take to treat your patient. Clinical reasoning, judgment, and your decision making is all built on a foundation of knowledge, experience that you've had, and the personal attributes of the person who is doing the reasoning, which would be you. Critical thinking is a very fundamental part of the process for clinical reasoning. And care can become very ritualistic and depersonalized when nurses fail not to implement clinical reasoning. We have person-centered nursing practice. So the nursing practice describes the way in which your care is going to be organized through a series of actions undertaken in response to the individual needs of each patient. The components of the nursing process are going to be assessing, diagnosing. So you're going to assess what's wrong with the patient, what do you see, what's happening, what's going on. Then you're going to do diagnosing, now what is happening? I think it's this, or I think it's that. And then we're going to move into planning. So what are you going to do for this patient? Based upon what you see and what you recognize, what are you going to put into motion to help solve the problem? And then you go to the implementing stage where you take that plan and you put it into action And then you have evaluating. So after you assess and diagnose, you formulate a plan, you implement that plan, you're going to want to go back and evaluate that plan and see, did the patient meet the needs? Were you able to fix the problem? And if not, then you have to make more changes. And then you have the nurse's action in response to individual clinical needs. So the healing action that occurs in response to individual needs completes the cycle of that thoughtful practice when it's considered and it's personalized, when the care is appropriate, when the care is valued by the patient, and when it is effective. Okay, so this again is just the components of thoughtful practice. You have your reflective practice, which leads to personal learning, the nurse's personal attributes, that knowledge base, the clinical experience, the competencies. In the middle here, you have the patients, and you see how all four of these affect each other, right? Your nursing process, your clinical reasoning, your judgment, and your decisioning making. They all work together. So there are 10 guiding principles of person-centered care. So you have to recognize that all team members are considered caregivers, okay? You are just one part of the team. You're just one part of the team. You have to identify other team members that you work with while you're implementing that plan of care. Everyone in the workforce, from housekeeping all the way to the CEO, is part of the patient's plan of care, and everybody has just as an important role as you do. So for example, you have housekeeping that needs to come in and tidy up the patient's room, disinfect it to prevent infection. That is really important. You have physical therapy and occupational therapy that come to work with your patients so that they can identify any needs or any barriers to them being discharged and what kind of help they're going to need at home. Again, a very, very important part of the team to help give that patient all the care that they need. So you have to be able to respect the people that you work with. You have to understand that their job is just as important as you, especially when you're running around and you have 5 patients and you're trying to get in a room and give meds, but maybe PT's in there and you can't get in there. Well, you have to recognize that everybody needs to have their turn with the patient, and you kind of have to plan accordingly. So number 2, the care you provide is going to be based on a continuous healing relationship. So you have to stop and think, what did you do today to make your interactions with the patient and their family qualify as a healing relationship versus just a business transaction or a provision of service? This principle reinforces a focus on the continuum of care. So in what ways did your care anticipate and prepare your patient and family for the days ahead? So you have to look ahead and figure out what's going to happen in a couple of days. What can you do today to make that continuum of care as smooth as possible? The care you provide is customized and reflects your patient's needs, your patient's values, and their choices. So what have you learned about your patient and their family as unique individuals? Did you, by interacting with them, recognize any strengths that they have, any weaknesses, any needs, maybe if not in the setting of the hospital, but perhaps when they go home? What are their values? What are their preferences? Knowing all these things will help you formulate a better plan for your patients' care that you provide, and ultimately help them be more successful in their care once they go home. You want to make sure that you are individualizing their care plan based upon all those needs. You have to develop strategies to elicit the patient's needs, values, and choices. So how are you going to get your patient to tell you what their needs are, what their values are, what they prefer? Not every patient is very forthcoming with that information. So you have to develop ways to get that information out of the patient. And in what ways is your care plan different from the standardized care plan? So care plans will come already preloaded based upon illnesses in the hospital, but you have to take those plans and recognize what your patient needs and tailor those plans to their needs. Then you have knowledge and information. You want to make sure that knowledge and information is freely shared between patients, care partners, physicians, and other caregivers. So when you're thinking about your practice, you want to say, what way did I share information with the patient or their family? And what way did I share information with the other doctors, the PT and OT, was there something important that I should share with them, letting the patient know that letting PT know that maybe at home the patient already has a walker and that they usually ambulate with a walker at home. Those things are helpful. What did you learn from other members of the team that enhanced your ability to provide care for your patient or family? That's why communication with all aspects of the healthcare provider team is extremely important, because you learn a lot from each other. And number 5, care is provided in a healing environment of comfort, peace, and support. So when we think of a healing environment, some people might think of music, maybe healing gardens, soothing colors, whatever. Everybody has their own idea of what they think is healing. But you want to constantly assess your patient's healing environment and think of ways of what you can do to facilitate the creation of an environment like that that helps them heal. So maybe you go into their room and it's messy and people have covers and gowns and supplies all over the place. So you go in and you tidy up the room and you keep it clean. I mean, most patients are in very small rooms to begin with. They don't have a lot of control over their environment. So keeping that room organized and neat and helping them feel comfortable can make a big impact on their care. And then in what ways are you able to address the variables that negatively influence healing? So noise, time constraints, their environment, like maybe the heat needs to be adjusted. Maybe they're freezing, maybe they're sweating, maybe they need more covers. Then you want to think about what percentage of your care plan or your care plan addresses the patient's needs other than physiologic needs. So just don't think about those physical needs. What's going on mentally? What's going on spiritually? You want to treat them holistically. So you need to think about all the needs. And then to what degree are the psychosocial spiritual needs of the patient identified, and to what degree do they appear in your care plan? Maybe the patient really needs a lot of spiritual and psychosocial support, and you're going to want to include that in your care plan. Maybe they don't really need a lot of that, so you don't have to put as much into your care plan. And then you want to think about what measures you can implement to promote the patient or family's comfort and peace and to provide support. So maybe you're going to put the patient's family member's name up on the board with a phone number, and you're going to agree to contact them once during your shift and update them, or whatever ways that you guys can come up with together to give that family support and sense of peace and support. And then number 6, families and friends of the patient are considered an essential part of the team. So has your patient identified upon admission that they have certain family members that he or she wished to be part of their team? Maybe they did, maybe they didn't. You can certainly ask, who do you live with at home? Is there anyone that you want me to update about what's going on? Is there anyone that is responsible for making your decisions at home? Is there anybody legally valid to make their decisions if they can't? And in what ways have you communicated with these people and provide the information and support that they need to help the patients, especially in times like these where we're dealing with COVID and family members cannot be with their loved ones? It's a hard situation for the patient. It's a hard situation for their loved ones. So establishing that line of communication, who are you going to talk to, and making sure that you make it part of your day, maybe not in the beginning of the day when you're passing meds, but setting up a time to contact those family members and give them an update. And number 7, patient safety is a visible priority. So you need to be aware of your institutional commitment, the commitment to safety measures where you work, like hand hygiene to prevent infection and other protocols to prevent hospital-acquired infections, medication and other errors, falls. What does your facility do to decrease their risk of falls? Do they implement bed alarms? Do they implement signs on the door? Do they give the patients red bracelets and red socks? So you just need to be aware of what is important to your facility. And in what ways is your particular patient at risk for safety concerns? So you're going to make sure you're doing your fall risk assessments, making sure to see, do they have catheters in? If so, is there nurse-driven protocols that you can implement to remove that Foley when you think they don't need it anymore? Are they at risk for violence? Anything that would put your patient at risk of not being safe. And number 8, transparency is the rule in care of the patient. So in order for you to implement true person-centered care, there needs to be some type of transparency between the providers and the patients. Patients or their designees need information so that they can make informed decisions for themselves or about their loved one. And you need to make sure, does your patient have the information he or she needs to make informed decisions? Do they completely understand everything the doctor's saying? Is the doctor speaking in a language that went right above the patient's head and the patient's just nodding yes because they think they need to and they don't really understand? These are the things that you want to be responsible for, and this is a part of advocating for your patient. Number 9, all caregivers cooperate with one another through a common focus, which is on the best interests and personal goals of the patients. So what ways are the clinical decisions or institutional policies motivated by goals other than the best interests and personal goals of the patients? And how is this constraining the care plan? What have you done to address these variables? What institutional resources exist to help you address these variables? These are all things that you want to think of. And number 10, and most important probably, is the patient is the source of control. Oops, sorry guys. The patient is the source of control for their care. You want to look at, and assess the degree to which your patient or his or hers designee of care is the source of control of their care plan. How much do they control? How much of a say do they have? What factors are inhibiting them from being able to take part in having control in their care plan? And you have to remember, like I said before, patients don't have a lot of control over their environment when they're hospitalized. So being able to have input on any decision or any part of their care is going to be extremely helpful and beneficial. All right, so beliefs of the International Association of Human Caring. So there is no like universally accepted definition of caring, and many people think it's many things. If we asked everyone in the room right now what they thought caring was, you would all say something different. So if you look at table 13-1 in your Taylor book, you can become familiar with some of the care models that are described, and you yourself can see if you agree with the convictions that are held by members of the International Association of Human Caring. So this association believes that caring is a human mode of being. Caring is the essence of nursing and the moral imperative that guides your nursing practice. They believe that caring is both spiritual and human consciousness that connects and transforms everything in the universe. They believe that caring in nursing is action and competencies that aim towards the good and the welfare of others. They believe that caring in nursing is a special way of being and knowing and doing with the ultimate goal of protection, enhancement, and preservation of human dignity for the patients. And they believe that care is culturally diverse and universal and provides the broadest and the most important means to study and explain nursing knowledge and nursing care practices. So as a nurse, you're going to want to reflect on how these convictions are going to influence you and your future practice or your current practice. If you agree that caring is essential to being and that the way that nurses promote healing, what are your personal strengths and what are your opportunities for growth for caring? How can you plan to focus your attention on human caring as you struggle to master tasks like transferring patients, assisting with bathing, administering medications? So when you first become a nurse, it's really hard for you just to get down your task-driven obligations during the day, like giving those meds and managing your time. And then as you slowly get better, you have to add in, being able to assist with a bath here and there, or being able to transfer a patient. So you have to try and figure out how are you going to meet all your obligations during the day that nursing requires of you, but also be able to care for your patients and genuinely take time out of your day to make them feel like you care and do those extra tasks. And then how likely are your patients going to describe you as a competent, compassionate, caring nurse? And in what ways might nurses relate to patients who may evoke negative feelings, and how will you prevent this from happening in your practice? So these are really, really important things to think about. Lost my page here. Give me a second. Sorry. Okay. So the professional nurse. The professional nurse, we're going to talk about personal attributes, knowledge base, and blended competencies. These are three things that together help make up the nurse as a whole. So personal attributes, when we look at personal attributes of a nurse, some of the things that we might think of are open-mindedness. So are you able to learn what your patients and your families and colleagues have to teach you? Because even though you have this great education, there are still a lot of things that your patients and families and other colleagues can teach you. You're constantly learning. Caregivers know a lot about the people that they provide care for. Family members that care for their loved ones know better than we do. So we can't have the attitude that we know everything and that no one else knows anything, because this is the only field where you can basically never know everything, and it's completely acceptable. You're always learning. So you need to be teachable, and you need to be very open-minded. Other personal attributes are having a profound sense of the value of the person. So do you believe that everyone matters? Can you think of anyone who deserves less than your best care effort? Are you willing to go to bat for the most vulnerable patients that you care for? Are you committed to learning how to advocate for those that are not well served by today's healthcare system? Because you are going to see those. You want to have self-awareness and knowledge of your own beliefs and values. This is so important. So do you know what you believe in and why you believe in it and why it's important? And do you know what the consequences are for your beliefs? And are you very sensitive to how your beliefs and values influence your professional relationships? So these are things you need to be aware of. And I like to use the example of, some nurses work in GYN clinics that perform abortions. So if you know that your beliefs already before working there are that you don't agree with abortion and you're strongly against it and you're pro-life, then you have to understand, can you take this job and put those beliefs aside, or is it going to implement the care? Is it going to cause you to give care that's not professional because of your opinions? And then you want to have a sense of personal responsibility for your actions. So at the end of the day, will your patients and your team be better because of their experiences with you? Are you going to be committed to using your own personal expertise, your time, and power to coordinate all the care patients and families' needs? You need to be responsible for your actions. Motivation to do what you do to the best of your ability, because ultimately you care about the well-being of those entrusted in your care. So what gets you up every day and motivates you to study and to practice? Do you have a love for nursing? Have you always wanted to do it? Do you believe that your personal best for those who will count on you? Do you want to be your personal best, knowing that everyone, the doctors that you work with, other team members and patients depend on you? The answer to that should be yes. Do you have leadership skills? Have you tried to use your influence or your past experience to help others attain valued goals and educate them? Are you committed to using your leadership skills with your patients, your families, and colleagues to help achieve valued health goals? And then lastly, bravery to question the system. So when the care plan isn't working for your patient, or your work environment is interfering with your ability to give good care, like maybe instead of having 5 patients, you have 6 or 7, or maybe the acuity of those 5 patients is so high that you feel like you're neglecting patients. Are you willing at that time to just challenge the status quo? And can you do it effectively? Can you go to your manager and say, look, this is how I feel. I feel like I'm putting my license on the line. I am not providing safe care to my patients. Mrs. Jones needs X, Y, and Z, and I haven't been able to give her that today. Are you going to be able to do that? Are you going to be able to advocate for yourself, your colleagues, and your patients? At the end of the day, what is going to be your active courage? How are you going to influence your environment? What's going to be the legacy that you leave behind when the day comes that you're no longer able to show up to the unit you work on and practice? When you retire, what do you want your colleagues to say about you? What is the legacy that you are going to leave behind? So then we have knowledge base. So knowledge base, in order to reason through any type of clinical situation, you need to be able to draw upon a certain body of nursing, a body of nursing knowledge. And some of that knowledge comes from your schooling, and other comes from just life experience and other experiences that you've had. So for an example, if there's a situation for reasoning about some type of clinical problem, the nurse needs to understand the disease or the condition that the patient's experiencing, its epidemiology, who's going to get it, who's most prevalent in getting it, where does it come from, the mechanism of the pathophysiology, how does this disease or condition occur, what's it doing in the body, how's it going to physically and psychologically manifest in the patient, what kind of signs and symptoms are we going to see, and what are the probabilities of it progressing, or what are the outcomes going to be. So that's your knowledge base. And then you have blended competencies. So nurses, let's see, I don't think I moved it, sorry guys. Blending competencies. So blending competencies, nurses try to design and manage each patient's care scientifically, what you learn in school, your evidence-based practice, holistically, emotionally, spiritually, physically, and then creatively. To do this successfully, you need many cognitive, technical, interpersonal, and ethical and legal competencies, along with a willingness to use them creatively and critically when working with your patients, so that you can help promote or restore health to your patients. You want to prevent disease or illness, and you want to facilitate coping with any kind of altered functioning. You want to have cognitive and technical competencies, which are going to allow you to manage clinical problems that come from the patient's changing health or any kind of illness state. And then you want to have interpersonal and ethical skills. And they're very important for nurses concerned about the patient's broader well-being. So let's talk a little bit about blended competencies. So blended competencies. So developing technical competencies is very important. So some people are very quick to master certain procedures that involve working with technical equipment, and then there's others that are going to have to practice the procedure many times before they feel confident handling that. And that's completely fine. Everybody learns at their own pace, but developing a certain habit can help you master skills that can be essential in the nursing process. So when you come across a procedure that demands some kind of manual dexterity or a complex series of steps like programming and a pain pump, you should practice that skill until you feel confident in your ability to do it, and before attempting to perform it with a patient. You can do any kind of simulation exercise. Usually in hospitals, they have skills labs where you can go and practice your skills, and they make you do it a couple times a year to make sure you feel comfortable doing it. You can always talk about it with another nurse before you implement it. Go over it in your mind, talk it out. Better to make a mistake with the patient, with the nurse, before you go in and do it with the patient. And you can also have a nurse come in and help you. You want to take time to familiarize yourself with the equipment. Before using it, you want to understand how it works, what supplies you're going to need to make sure that it's functioning properly. And then if you can, you want to try and anticipate any problems and know how to take care of them before they arise. It's very helpful to identify who your experts are, who the nursing experts are on the unit. There's always super users for everything. You can ask them to share their secrets and their tricks with you. Many of your experienced nurses have developed quality time-saving techniques, and usually they're willing to share. And probably the most important is to never, ever, ever be ashamed to ask for help when feeling unsure about how to perform a certain procedure. I've been a nurse for 6 years. I've seen chest tubes probably 3 times. Whenever I get a patient with a chest tube, I always have to go over it. I have to pull the policy from our website, and then I have to go over it with another nurse, and I just talk things out because I don't do it all the time, so I don't know it. And it's nothing to be ashamed of, but I'm advocating for my patient, and I'm making sure that I'm giving them the best, safest care by being teachable and open-minded and going to others that I know can help me. And then never overlook the patient or the family's caregiver as a source of helpful hints, because they provide care for these patients routinely. They know what the patients need. They know what their routines are. They know what they're like. So they are a huge help for you. And never forget that the patient's well-being and sometimes the patient's life depends on your technical competence. You want to develop interpersonal competencies. So you want to promote human dignity and respect. You want to, sometimes as nurses, we underestimate the power that we have to make a patient heal just through being respect and having like a caring presence. Sometimes it's just as simple as going into that room, introducing yourself, and your patient starts talking and you sit there for 10 minutes in complete silence and listen. It's very healing for the patient. It empowers them, and it makes them feel like you really care about them when you take the time to listen. It didn't cost anything on your part but 10 minutes, and it's very genuine, and it's considered being open and present for your patients. Each time you walk into the room, you communicate one of two messages: that they're a job and they need to be done and they mean nothing to you, or you are a person of worth and I care about you and I'm here for you from 7 to 7. What are your goals of treatment? What can I do for you? So some questions that you can ask yourself to make sure that you're promoting human dignity and respect are: what are my strengths and deficiencies when it comes to respecting patients? What patients challenge me the most in my ability to give care respectfully? How do I respond to these challenges? What can I do to be better at handling them? What does this teach me for the future? In what ways must I change? Which ways can I change my practice so that I can be faithful to the duty of respecting the dignity of each patient, not just the patient, but their family members and my colleagues? And what does it mean to respect the dignity of patients? Maybe you don't even know what that means. So what does it mean? And then make a list of 5 concrete ways that you can demonstrate respect and incorporate them into your practice every day. You want to establish caring relationships. So what does the content of the patient report and nursing documentation communicate about nursing priorities in your practice setting? What are your strengths and deficiencies in creating caring relationships? Do you know how to talk to patients? Are you actively listening to them? Are you being present with them? Are you anticipating their needs? Are you being honest with them? Are you being responsible for your actions? Okay. Do you know your patients well enough that you can promote anything for them more than just their physical well-being? Do you know what their spiritual needs are? Do they need the chaplain to come and talk to them? What do they need? If asked to describe a patient, would you be able to report on anything other than their physical condition? Other than Mr. Jones has a right hip fracture, are you able to say that Mr. Jones is very particular with what he eats? He doesn't want to go home and stay by himself. He needs a walker. What kind of things do you know about your patients that show that you have a caring relationship with them? And then you want to enjoy the rewards of a mutual exchange. So it's really easy to get caught up in just giving meds, documentation, doing all those task-driven things. Sometimes you need to think about, what did I do for my patients today? What did I do to communicate with them? Or how is your mood today before you even start your shift? How is the mood that you came into work with going to affect the care that you give to others? Have you ever consciously tried to transmit strength, peace, or support or joy to another person? What have you done for that person? Maybe you're taking care of a cancer patient and they don't smile at all because they are going through a really tough time in life. What can you do just to make them smile? Maybe that's your goal for the day, to listen to them and somehow think of some way, some little thing that you can do. Maybe just making them, maybe they mentioned that they like hot tea and their tea was cold when they came up. So maybe you go into the lounge and you make them a hot cup of tea. Little things like that. Are you aware of any situation in which your own fatigue, your own anxiety issues, your own frustrations or negativity could have been communicated to a patient in a manner that negatively influenced their patient's well-being? These patients are already sick when they come in. They are already dealing with things. Any issues that you're dealing with on the outside, you need to leave it at home. Nursing is not the place where you can bring your problems to work. And are you conscious of ways in which your patients enrich you personally or enrich your practice. I was an oncology nurse for 6 years. It was the best thing I ever did. I love my patients. They did more for me, I feel like, than I ever did for them. I loved taking care of them. I liked accompanying them on their journey. I liked making them happy. I liked listening to their stories, and it made me feel really good to be able to just make some type of impact on their journey that was positive. So take that time to really know your patients. Find out what their interests are. Find out what their likes and dislikes are. Don't get caught up in the charting and the tasks. Those things are important, but it is possible to balance them. You want to develop ethical and legal competencies. So nurses are committed to interpersonal caring. You have to hold yourselves accountable for human well-being of all your patients because they entrust you to care for them. Being accountable means you have to be attentive and responsible to the healthcare needs of each individual patient. It means that your concern for the patient will transcend whatever happens during your shift, and that you will ensure a continuity of care when you leave that patient. So when you're giving report to the nurse that's coming in to relieve you, you're going to make sure that that continuity of care goes well past you. So what's going to happen during the next person's shift? What kind of medicines are going to have to be given? What kind of procedures are they going to have? Make sure that you're telling those things in your report. Because of the acuity and the nursing shortage, we're seeing increasingly fragmented care, and patients often find themselves unable to point to any single caregiver who knows their overall situation, which can be hard. Not all nurses work 3 days in a row, which makes it ideal. When nurses work 3 days in a row, they have the same person for each 3 shifts. That person gets to know them, and that contributes to a positive continuity of care, but it's hard for that to happen. So it's important that you coordinate your efforts with the healthcare team. Make sure that you can give as much information as you can during that bedside report so they can continue providing for them the way you did. Be responsive and responsible, okay? That's going to earn your patients' trust that they are in good hands and that all their healthcare needs are going to be addressed. So nurses who are sensitive and recognize the legal dimensions of their nursing practice are very careful, and they develop a strong sense of ethical and legal accountability. Competent practice is a nurse's best legal safeguard. As a nurse, you're going to want to seek to develop legal competence, which will be help you in your practice and help you be safe and provide the best possible care for your patients. So you might want to ask yourself questions such as, am I familiar with pertinent institutional procedures and policies? Do I know what the policy is about inserting a Foley? Do I know the policies about handling a central line? Do I own my own personal strengths and weaknesses and seek assistance as needed? Like I said before, I use the example of the chest tube. I don't know how to handle chest tubes because I've only ever handled 3 of them. I'm not ashamed of it. It's something I don't deal with every day, and I recognize that it is a weakness and that I need to seek assistance so that I can provide the best possible care for my patient and keep them safe. Am I, as a nurse, careful never to accept responsibility for an assignment for which I'm underprepared? So if you are a new grad and you've only been a new grad for 2 months and they try and give you 7 patients or 5, you need to, instead of 5, you need to advocate for yourself and know that this is not something that you're going to be able to handle and you need to go to the charge nurse. Are you knowledgeable about and respectful of patients' rights? What are your patients' rights? What if your patients' rights aren't being met? Who do you go to? What's that chain of command? And does your documentation provide a legal defensible account of your practice? Are you documenting everything accurately like you're supposed to? You're not cutting corners. Those are your legal and ethical competencies. And that is going to be it for patient-centered care. Next is going to be our last lecture for nursing process for week 4.